Welcome to the On the Pen, the weekly dose podcast, your one-stop shop for obesity medicine news with your host, Man on the Pen, Dave Knapp. Welcome to the On the Pen, the weekly dose podcast for this week, Tuesday, October 22nd, 2024. I'm Dave Knapp, Man on the Mounjaro. That's why I'm here. You are on the pen. Wegovy, Saxenda, Victoza, Trulicity, Mounjaro, Zepbound, Compound, that pen. That's what we talk about here every week so that you can have more competent and confident conversations with your medical providing team. We give you all the news in incretin mimetics, and this week is no exception. There is a ton of news. We're going to jump right into the Eli Lilly tirzepatide compound saga as breaking news happened yesterday. Eli Lilly dropped 3 lawsuits in its effort to shut down vendors producing and distributing copycat versions of tirzepatide. They took some interesting angles yesterday, dropping 3 separate lawsuits against a med spa, a research-grade peptide company operating in the gray market, and a telehealth company branding its own oral formulation of tirzepatide under a different name. These all have, I think, meaningful impacts to compounded tirzepatide and the broader discussion about Eli Lilly's defense of its patents in peptides. And I think that there's just a lot to talk about here and a lot to continue to unpack as this news that is happening today feels like it's very impactful for what's going on in the current landscape of accessibility. But I'm here to tell you that this will impact accessibility for years and years to come, what's happening in the courts right now, not only with Eli Lilly dropping these lawsuits, sending out hundreds of cease and desist letters last week that could lead to additional legal action beyond just these 3 lawsuits. In fact, these 3 lawsuits, as Eli Lilly stated in their comment to Reuters, was really unassociated with the fact that tirzepatide had been removed from the shortage list. These were lawsuits that were likely to go forward regardless of what happened with the shortage. Of course, at the same time, you see Eli Lilly actually suing the FDA to get retatrutide or retatrutide, the triple G, the next generation, basically classified as a biologic so that no compounding could ever happen. It would also extend their market exclusivity with retatrutide and make it so basically there would be no generics for a very long time. We've got into that topic. We've done deep dives into that before. That's why you subscribe to the channel on YouTube, because we do lots of videos that give context around that. But for the purposes of this week, I want to get into the aspects of these 3 different lawsuits, why I think they're impactful, and then I think what we could see come out of these as a potential game changer. So let's get into the med spa. So the med spa that Eli Lilly is suing, they're basically suing because this med spa, and they're not alone, many compound pharmacies, many med spas, and even telehealth companies are now in an order to sort of circumvent the patent since the shortage is over, are offering 503A compounded versions of tirzepatide that basically mix tirzepatide with something else, L-carnitine, L-arginine, B vitamins, whatever it may be. And basically in this lawsuit, Eli Lilly is claiming that the mixture of these 2 compounds, tirzepatide and B12 in this case, are an untested and potentially unsafe combination to offer patients. Now, this is an interesting track because I would think that the argument would be more along the lines of the fact that those 2 things can be administered separately, that they wouldn't need to be combined in the same formulation for the patient to get the same effect. You can have a B12 injection and you can have a tirzepatide injection. Why the need to combine the 2? But they definitely have gone after the safety aspect of it, which maybe the courts will be more favorable to. I don't know or profess to understand the legal implications to these court cases, but I find that argument interesting because B vitamins seem to be fairly innocuous. But we'll have to see what comes of it. But this is sort of, even though Eli Lilly's not bringing this case against somebody that they've sent out a cease and desist letter to last week, it's an interesting thing to see them sort of take the track that this type of compounding is unsafe. And so I think they are kind of grabbing at some of the strategies of the compound providers that they took last week over the last, let's say, 2 weeks to sort of shift their offerings of tirzepatide. So it'll be interesting to see how that one shakes out. Of course, they also went after a gray market peptide company, a research grade peptide company, which is very interesting because one of the first things that we saw when the telehealth pulled back sort of universally after the day after the tirzepatide shortage was ended by the FDA, we saw many people online in forums and comments immediately sharing links and information about their decision to move to this gray market area. Now, as a quick flyover, the gray market area of peptides are basically peptides that are manufactured primarily in China and India. They are white labeled and sold over here by any number of marketing companies as research purpose only chemicals. In other words, they're not for human consumption. So they're not under the same regulations as a pharmaceutical drug because these are not for human consumption. And so these companies market them and sell them pretty much unabated in the United States. They are not subject to any sort of oversight when it comes to regulation of sterility. These are not coming from pharmacies. They're not coming from FDA inspected sources or State Board of Pharmacy sources. They are simply coming from overseas in most cases and sold by a marketing company that slaps a pretty label on them. Oftentimes will run a certificate of analysis that they'll provide on their website, but there's no oversight of that either. So there's no way to know for sure that the medication that you're getting or the research grade chemicals that you're getting are associated with the certificate of analysis that you're looking at. Because again, there's no regulation because they've absolved themselves of any sort of liability by selling these as research grade and not for human consumption. So this is a very sketchy gray market. And unfortunately, an unintended consequence of removing tirzepatide from the shortage list is that it's pushing many people to these because they're obviously cheaper, they're obviously more accessible, but definitely a gray market and a cause for concern, as it's only a matter of time before somebody gets hurt by these types of things. You see dosing issues even in the compounded versions that come from 503A, 503B pharmacies, just confusion on people's part about how much to dose themselves with. These are, of course, arriving to people in lyophilized powder that is reconstituted with bacteriostatic water in their home, which is obviously not a sterile environment. Just so many opportunities for people to be harmed in this. So Eli Lilly went after one of these companies, basically, following through on a cease and desist letter that they had sent about a few months ago, because I think that they foresaw this happening. And so they saw a need to maybe go after some of these gray market peptide companies. It's interesting to see them actually going after one of them in a lawsuit. So you kind of see how this case is stacking up. They've got a med spa selling a compounded version that is mixed with another compound, in this case B12. You see them going after the gray market. And this third one is perhaps the most intriguing one to me because I think you're going to find this interesting also. So this third case is targeting repackaging and rebranding of tirzepatide by a telehealth company who is offering tirzepatide in an oral formulation, but they've sort of gone one step further. Not only are they offering an untested version of tirzepatide in an oral formulation, in this case, I believe it's a chewable tablet, They have also, the company, MangoCeuticals, has also rebranded it entirely and called it their trim line and packaged it in their own proprietary branding. And it's very interesting to see Eli Lilly go after this one, because this is the type of case that I think could be low-key a real challenger to the patent itself of the peptide. Now, not to get too much into the weeds on this, but one of the very interesting things that you've seen over the course of time is that these pharmaceutical companies are much more comfortable defending the delivery mechanism with which a drug is distributed, because there are many, many elements to a patent for a pen. Again, not to get too much into the weeds here, but device innovation and complexity offers a layer of protection between the patent of the drug and its challenge in court. In other words, the features that are built into these devices are easier to patent and defend because they involve mechanical engineering, novel designs that are clearly and easily demonstratable. The patents protecting these devices may cover intricate designs, delivery mechanisms, or other proprietary aspects that competitors would find difficult to replicate without infringing upon that patent. A single injectable device like this single-dose pen from Eli Lilly can be covered by multiple patents, like the design of the device, the method of injection, or safety features built into this pen. There's basically layers of patents that they can defend in court. Now, peptides are something that I would think, at least, a drug company would rather not defend in court, because peptides are these peptides, in the case of tirzepatide or semaglutide, they're mimicking naturally occurring hormones. In tirzepatide's case, GIP and GLP-1. In semaglutide's case, GLP-1. And so there are slight modifications to naturally occurring peptides, which sort of limits the scope of the patent. In other words, where you have like 5 or 6 different things within a pen that you can patent: safety features, delivery mechanism, design, the mechanical engineering behind it. A peptide is really just a mimicking molecule of a naturally occurring peptide. And so defending the patent for a peptide can be more difficult if the formulation involves standard techniques, or if the synthesis process is not novel enough to merit strong patent protection. So Eli Lilly must feel very confident in their ability to defend tirzepatide, because essentially that's what they've gone after in this fight that they picked, right, with MangoCeuticals. Now, MangoCeuticals is a publicly traded company, I believe, that saw a big jump in their stock earlier this year, back in May, I believe, March or May, when they decided that they were going to sell this formulation that they had come up with for oral tirzepatide. And so their stock saw a boost. They've been selling it pretty much unabated on their website, MangoCeuticals RX, I believe it is. I don't know. I'm not encouraging anybody to go look at it. But it's very interesting to see that Eli Lilly has picked this fight, because the MangoCeuticals CEO came out yesterday and said, "We feel very confident in this case. We've been preparing for this fight. We're ready for it. And we feel like we're going to win." So it'd be very interesting to see if Lilly actually lost a defense of tirzepatide. That could have massive implications to the compounding market for tirzepatide over the next couple of years. So I'm just sort of surprised to see them go this route and going after somebody who's making it. Perhaps the fact that this company is making a pill form maybe gives them some sort of legal edge. Again, I'm not a legal scholar by any stretch of the imagination, but it's just it seems like an interesting fight to pick, because I wouldn't imagine that they would be eager or chomping at the bit to defend the tirzepatide patent itself in court. But this will be a very interesting one to watch over the course of the next year or so as this plays out. And it will also be interesting to see if they go after some of the telehealth companies or compound pharmacies that they sent cease and desist letters to last week, because as we've talked about on this channel, the patents for tirzepatide are something that I can't imagine Eli Lilly wants to defend in court, but they are. And so it would be very interesting to see if they go after some of these compound pharmacies ultimately. But time will tell. It's interesting, their strategy here. They seem to be targeting, at least initially, some smaller outfits that maybe don't have the legal resources to defend themselves, maybe trying to set some precedent. But if they enforce these cease and desist letters, I would be very interested to see how those pan out. So we'll stay on top of this for you here at OnThePen. And of course, we'll continue to bring this news as it unfolds. Now, when we talk about accessibility to these medications, I think it's very important to point you in the direction of our podcast sponsor, Ro. Now, Ro has been sponsoring the OnThePen podcast and their weekly live show for a couple of months now. Ro is an amazing company. I was so thrilled when they asked me to be a community advisor with them. And essentially that puts me in a role where I get to advocate for the community with a super large telehealth company like Ro that really cares about patient accessibility. Now, they have a program called the Ro Body Program. The Ro Body Program is an amazing program that will connect you to a provider that, when appropriate, can prescribe GLP-1 medications that help patients who, coupled with lifestyle modifications, lose 15 to 20% of their body weight in a year. So I highly recommend you check out ro.co/OTP for OnThePen, ro.co/OTP. If you need access to these medications, they will fight the insurance battles, the prior authorizations. They will do all of that for you. They've got a seamless app that makes the whole experience frictionless. It is second to none in the industry. You can get there again by checking out ro.co/OTP. If you are going to start any new medication, you want to be familiar with the side effects that come along with those medications. Of course, all of that information is just a couple of clicks away there at ro.co/OTP. Check it out, learn as much as you can, have more competent and confident conversations with your doctor. OnThePen will actually be bringing you live coverage. We'll have a team down there. There will be several of us down there bringing you everything that happens at Obesity Week. That's the first week of November. If you would be interested in considering a gift to help sponsor us, the costs associated with this are not insignificant. So if you would like to consider a gift to help us down there as we bring you live Obesity Week coverage, it would be greatly appreciated. You can do so by just looking at this scrolling banner across the bottom, Cash App, $ManOnMounjaro, or Venmo at OnThePen. So if you would feel so led to help support OnThePen's efforts to bring you Obesity Week live this week, which was sort of a shot that I called this time last year while it was going on, that would be super, super fantastic. Now, moving over into some interesting news that sort of came out yesterday about the Catalent and Novo Nordisk deal to lay the groundwork. All of these, Novo Nordisk, Eli Lilly, but anybody looking to get into the GLP-1 game has to consider their ability to manufacture the drugs to meet the demand. 190 million plus people living with obesity or overweight in the United States alone. Two companies will never be able to build out enough capacity to meet that demand in a reasonable amount of time. So one of the tracks that Novo Nordisk did is they looked and found their largest vendor, basically, which was Catalent. And Catalent is basically a generics manufacturer that has tons and tons of capacity. So where you see Eli Lilly investing, $20 billion in the United States and expanding, well, not just the United States and Europe, and expanding manufacturing capacity to make more of these life-changing medications. Novo Nordisk sort of took a different track, and they looked at Catalent, this generics manufacturer, and they said, we're just going to buy you. Basically put an offer on the table for $16.5 billion to just basically buy up all the capacity that Catalent has. Now, the implications of this deal would be one might argue devastating for the generics market, because if Catalent is gobbled up and just used for Novo Nordisk's ability to make Wegovy and Ozempic and CagriSema, which is coming down the line, then obviously that would impede on Catalent's ability to provide support to the scores of other drug manufacturers that they support with making the branded medications and generics respectively. So this has caused a lot of concern. Of course, this is being looked at closely by the FTC in the United States. This deal might not even go through, but Novo Nordisk is banking on this deal going through by the end of the year. Now, their CEO announced that he would be staying on as CEO, and sort of had to walk back some of the previous comments and some of the news articles that have been written, basically coming out yesterday and saying Catalent is committed to continuing to provide support to the entire industry. We're continuing to be dedicated to fulfilling contracts that we have, and so there will be no disruptions. We will be a reliable source to supply your needs for commercial product launches and therapies. You know, one of the things that we've talked about is Catalent actually helps to manufacture Mounjaro and Zepbound and even retatrutide for the clinical trials. So, you know, Eli Lilly's over here in the corner going, so you're telling me that this company that we've contracted all this stuff with is now going to be owned by our largest competitor in the market? And so it's just a very interesting thing. We've been following it here at OnThePen. It'll continue to be interesting to watch. But by the end of the year is when Novo Nordisk had expected this deal to go through. So we'll stay on top of this one, because I find this one just fascinating for many, many reasons. The least of them being how much this impacts accessibility. If Novo Nordisk is able to gobble this up, they honestly could run roughshod, because depending on how much Eli Lilly relies on Catalent to fill this stuff could go back into shortage very quick if things got squirrely with the relationship between Catalent and Novo Nordisk and Eli Lilly. So we'll continue to follow that one. It'll be a fascinating one to follow. Hey, we've got a great show this week coming up on OnThePen Live. If you don't watch that show, you really ought to check it out. It happens every Thursday night at 9 p.m. Central. Of course, the magic of YouTube is that you can go back and watch it forever on demand. And we've been sort of laying the groundwork for what's going on with the OFA, the Outsourcing Facilities Association, suing the FDA to get tirzepatide put back on the shortage list. Of course, all of this could be a very moot point if Eli Lilly leverages its legal might and comes after the people that they sent the cease and desist letters to. We'll have to see. We'll have to see what happens. But we've been following it closely. So we laid the groundwork last week with Lee, our legal correspondent for OnThePen, who came on and helped give us the legal lay of the land of what's going on in this lawsuit, why maybe this fight has been picked up at this point. And where we sit right now. Now, this week we have an interview with Mr. Scott Bruner, who's the CEO of the Pharmacy Compounding Association. And so this is not the trade organization that's suing the FDA currently, but he's been an outspoken proponent of compounded versions of tirzepatide. Of course, that would be his position, as he represents an organization of compound pharmacies. But we're going to get his perspective on what's going on. And then the following week, hopefully we will hear from somebody from Eli Lilly or somebody who is associated with Eli Lilly that can give us sort of their perspective on what's going on with the shortages. We hope that we can bring you that. We'll see what happens with that. But that's sort of what's going on with OnThePen Live, both last week, this week, and the future week. And then, of course, that takes us all the way up to Obesity Week, which will just be a huge week. We're bringing it to you live, as I mentioned earlier on in this podcast. We cannot wait to bring you Obesity Week live. There's so much news that happens. And, of course, in the middle of all this, we'll have an Eli Lilly earnings call. So the next few weeks for OnThePen are going to be absolutely bonkers. Make sure that you hit the subscribe button if you're on YouTube. If you're following on the podcast, please give it a 5-star rating review. Make sure you download, get all the updates. But there's a lot of content, frankly, that you're not going to get on the podcast. So you really do need to go over to YouTube, subscribe, where you can get that. Or you can catch all of our content that feeds over into our website at onthepen.com. However you get it, make sure that you don't miss out, because, of course, as I mentioned, over the next few weeks, there's going to be a tremendous amount of news in the world of GLP-1s, specifically related to semaglutide and tirzepatide. So we hope you'll catch all of that with us over on the YouTube channel. Hit the subscribe button and the bell for notifications so you get notified every time we drop a video. We stay on top of this like no one else does. And we've been doing it now for 2 years. We've been following this information. So thank you for being here. Thank you for being the best part of what we do at On the Pen. Until next week, have a great week. Thanks for spending a little bit of your week with us, and we'll catch you on the next one.